TopMedTalk.
Hello and welcome to TopMedTalk. Here at Anesthesiology 2023, it's the annual meeting of the American Society of Anesthesiologists. I'm your host, Desiree Chappell, and I'm joined by my co-host, former editor-in-chief of TopMedTalk, Monty Mythen. Good morning, Monty.
Desiree, it's great to be back in the chair.
It is. We missed you a little bit. I know you've been busy with other duties over the course of the last couple of days.
In a strange few days. I did an interview early on with you, but then I handed over the editor-in-chief, having founded TopMedTalk, and you joined me shortly afterwards, to Professor Mike Grocott. And I'm now experiencing a new thing. As opposed to FOMO, the fear of missing out, I've got ammo, which is actually missing out. So I wander past every now and again and think,
I know.
But anyway, I'm back in the chair.
You are back in the chair, that's right. Well, if you're not familiar with TopMedTalk is a perioperative medicine podcast. We're global. We're listened to in over 100 countries around the world. We have over 2,000 podcasts and over 2 million downloads. So it's very busy.
I actually got some texts this morning from around the world about stepping down as editor-in-chief.
Oh, so...
They were remarkably polite.
Well, thank you for listening wherever you are in the world. We also wanted to say thank you to the American Society of Anesthesiologists for providing this beautiful space here within the exhibit hall. We couldn't have done this without you, so thank you so much. And thank you to all of our sponsors, Edwards Life Sciences, GE Healthcare, and Medtronic. You help us keep the lights on. You help us keep going and keep TopMedTalk and all this wonderful medical education free and open to everyone. So thank you so much. So we've had some amazing conversations over this weekend, and this morning is going to be no different. This is the one we've been the most excited about, and what we always are excited about here at TopMedTalk every year at Anesthesiology is our chats with the outgoing and incoming presidents of the ASA. So joining us today is Dr. Champeau and Dr. Ronald Harter. Gentlemen, thank you so much for joining us.
Absolutely a pleasure being here again.
All right, you're back in the hot seat again, Dr. Champeau.
Indeed I am.
That's right. Well, for our listeners, everyone out there watching today, tell us a little bit more about your background and then your presidency incoming this year.
Actually, I began my career in medicine as a pediatrician, but after completing my training in pediatrics, I saw the light and then trained subsequently in anesthesiology. And I've had the privilege of working mostly at Stanford University over the last 40 years, doing a mixture of pediatric and adult anesthesia.
Yeah. So we're in your hometown here for...
Very close to it. Yeah. I live just maybe 20 miles down the peninsula.
Yeah, that's right. And Dr. Harter, we'll come back to you in just a little bit. Well, why don't you tell us about your background?
Sure. Yeah, I guess I'm what you would call a lifer of ASA. My involvement with ASA dates back to when I was a resident. I did my residency training at Georgetown, and I was one of the officers of the Resident Component Governing Council 30-some years ago. And so since that time, that gave me early recognition of what a wonderful organization ASA is. And so I've had the opportunity to serve in various roles, serving on committees, House of Delegates, chairing committees, board of directors, and now this will be starting my 12th year as an officer for ASA. So just can't say enough good things about what a great organization ASA is.
Yeah, dedication for sure from both of you. Dr. Champeau, I just want to say congratulations on a fantastic year. This past year as president.
Oh, it's been one of the most rewarding and interesting years of my life. Certainly will enjoy having a little less hectic pace, but it has been, for someone when you're starting to get closer to the end of your career than the beginning, it's great to still have new stimulating things to do.
Yeah.
And so it's been a wonderful experience.
I'm sure. Well, it has been a big year for you, and we're going to talk about some of the opportunities, challenges, but also the wins that we've had and that you've had throughout the year. I first wanted to talk to you about some big changes that have happened over the course of your presidency in this last year. Lots of change in leadership. So Paul Pomerantz, who's been the CEO of the ASA for the last 10 years, is stepping down and going on to do new things. But I'm sure that was a big news for you and change, yeah.
Well, certainly now he hasn't formally stepped down yet. The transition will occur at the beginning of 2024. And it didn't come as a complete surprise to us. We knew that he would be nearing the end of his contract with us, and he was at a point in his life we knew we were going to need to conduct a search for his successor. We never want to say a replacement for Paul because nobody can probably replace him. So pretty early during my term, we started working on the search. And a crucial part of that is identifying the right people for the search committee and, of course, then the right corporate advisor for the search committee as well. we're fortunate. Mary Dale Peterson, who was our president back during the COVID period as a tremendous all-around administrator, anesthesiologist, intensivist, really led us through the toughest times in the society with great confidence and aplomb. We tapped her to be the chair of our search committee. In putting the committee together, it was probably a little bit large compared to some search committees, but what I was really looking for was broad diversity, and not just in terms of the traditional gender or racial or ethnic diversity, but diversity in terms of practice style, academics versus private practitioners, diversity in terms of geography. We wanted representation from around the country. And in fact, we had such good diversity. We heard that one of the candidates said that they really hoped that they would get the job just because any organization that would put together such a diverse search committee had to really have its priorities correctly aligned. So we put the committee together. We originally had 160 applicants, narrowed that down in stages, and ended up selecting our current COO, Brian Riley, to be Paul's successor. And Brian is held in the highest esteem imaginable by the staff. They're thrilled about his selection, and we're really looking forward to this. This is one of the decisions that made during my term that will shape the next decade for the society. So we're feeling quite confident that we handled that as well as we could have.
Good, great.
Well, congratulations on that, and we look forward to working closely with Brian in the future. I just want to say personally a very big shout out to Paul. He's been an amazing global ambassador for the ASA. You know, you see him pop up around the world. He's always got a smile on his face. He's always got a smart thing to say. We miss him already.
Well, and I've learned, again, I mean, I haven't been in positions of leadership like Paul for my entire career, the decades that he has, but you can really learn from people.
Yeah.
And of course, we all recognize his people skills are just phenomenal. And that was an obvious, but there were other subtle things. Like there were times when I kind of, would ask him, well, how do you deal with it when you get bad news or something goes against you? And he talked about his philosophy and that there's just nothing is gained by dwelling on that. You need to, always be looking towards the positive, the future, the better things to come. And that was helpful to me.
Yeah. We've also had some transition in leadership within the journal, correct?
I think this, again, represents a real opportunity for us. Evan Karish really did a fabulous job as our editor for a long time. Expanded as he, I think, used the phrase, the reach and the richness of the material. But it was time to make a change. And again, we put together an extremely diverse search committee, representation from again, the entire breadth of the academic field that we felt in our country. We had people representing different subspecialties, but again, different demographic groups. Again, a large committee. I think we had about 15 people on the search committee, which is large by those standards. But again, I think that ultimately served us very well. We didn't have, of course, 160 applicants because the number of people out there who can do a job like that is far more limited. But again, we retained a firm that specializes in assisting searches for editors of academic journals. I think we started off with, maybe 10, 12 really strong candidates. By the time we got it down to 4 or 5, we felt that any one of those that we ended up with was going to be a great fit for us. Where we've identified the successor, I guess I won't mention the name right now.
No official announcement yet, right?
Just because it still needs to be approved by our board of directors. Now that I don't expect there to be any kind of an issue with that, but until the board formally approves that, and that will happen on Wednesday.
Yeah.
And at that point, it will be a done deal.
Yeah.
Well, big thanks to Evan as well, because he was very generous to us with his time and also overseas with evidence-based peroperative medicine and the forums we had amongst the editors-in-chief, so big shout out to Evan too.
No, that's right. Evan was a wonderful ambassador for the journal overseas. I would see him, sometimes when we were out at international meetings. He was always there talking to authors. Obviously, we want to pull in authors from not just the United States, but all over the world. A lot of the best science is being done elsewhere. And so we need that presence in the international space to continue to draw the best articles. And we certainly intend to do that with our new editor.
Well, Dr. Champeau, here on Top Med Talk over the weekend, we've been talking about some of the challenges that, policies and legislation that we've had to face over the last, years. But this year, can you talk about some of the key legislation and policy that you really saw that really has affected anesthesiologists?
Well, on the positive side, the work done at the state level, which is where most defense, patient safety, defensive physician-led care, most of that is going on at the state level. We had a terrifically successful year this year. Our state affairs team, working with our component societies around the country, we were able to defeat attempts to inappropriately expand the scope of practice for advanced practice nurses in 18 states and really didn't suffer any what we would call setbacks. We also defeated this APRN compact legislation, which is sort of an attempt to expand scopes in multiple states simultaneously. That was defeated in all 7 states where it came up. So at the state level, we had a very successful year. The federal level, there were really 2 issues where that came to bear. One was that back during the early days of the pandemic, the administration, as part of their response to the COVID pandemic, waived many existing Medicare rules and regulations. And one of those is the federal requirement for supervision of nurse anesthetists. Interestingly, that made every state essentially an opt-out state during that time. It was interesting to us that as far as we could learn, no state, no institution, no hospital actually took advantage of that. No one changed their staffing in terms of who was actually caring for the patients. But that waiver was still floating out there, and we wanted to make sure that waiver ended with the public health emergency and that the underlying requirement for physician supervision of nurse anesthetists resumed. And I had conversations with attorneys at Health and Human Services, with administrators at Center for Medicare and Medicaid Services, and even with the White House Domestic Policy Council, urging them to allow the waiver to expire and the underlying requirement to come back into effect. And that happened in May with the expiration of the public health emergency. So that was complete success from our side. The other place where we're still working on that is within the Veterans Administration. For many years now, really almost a decade, there has been a push within the nursing administration of the VA to allow independent practice of advanced nurse practitioners. And way back in 2014, they made an attempt to do that. And in fact, the Veterans Administration at that time, looking at the issue, granted independent practice to 3 of the 4 classes of advanced practice nurses: clinical nurse specialists, nurse practitioners, and certified nurse midwives. At that time, they did not grant independent practice to the nurse anesthetist. The nursing administration has brought that issue back again, trying once more to grant independent practice to the nurse anesthetist. We've been working on that at multiple levels. We've met with top officials in the VA. We have had several meetings with influential legislators who have important financial or oversight roles over the Veterans Administration. We've had legislation introduced in both houses of Congress, bipartisan legislature, so there's no skew to it. I'm trying to block that independent practice. And we've worked particularly with 2 of the veterans service organizations, and notably the American Legion and the Vietnam veterans, to make sure that their voice, we know that their members feel that they want physicians leading their anesthesia care, and we're trying to make sure that voice is heard.
Yeah. Monty,
can I pick up on that language about physicians leading their anesthesia care? The reason I say that, you might be up to speed with what's happening in the UK, where I'm from and practiced for most of my career, where we've had a pretty much almost entirely physician-delivered anesthesia practice, which is not unusual in some parts of the world, for a long time until relatively recently. Now we're just transitioning into the Royal College of Anaesthetists, training, educating, licensing, whichever way you want to phrase it, alternative providers to help grow the team, because we have a very clear manpower shortage in the future. The reason I raise that is as people make their very appropriate cases to try and make patients safe, the language sometimes gets a little bit ugly. So we start to talk about victories and defeats and protecting patients. And I can imagine some of the young physician anesthesia people that non-physician anesthesia providers we're trying to recruit, listening to this and saying, well, I don't want to be in something where I'm being defeated and I'm not safe for patients. How do we balance that language out? Because it's a team game.
No, absolutely correct. And it's, I think it's very interesting. I agree with you. I think worldwide there is going to be a shortage of anesthesia practitioners. Given the years of training required for a physician specialist, whether we call them an anesthesiologist here or an anesthetist there, we are going to need to leverage that expertise with some non-physician practitioners. I think the question, though, is how you go about doing that. There are places around the world where the relationship between the physicians who are leading the team and the anesthetists who are working with them are excellent. I've worked in other countries, Vietnam is one in particular, where the relationship there between the anesthesiologists and the anesthetists completely harmonious. Everyone agrees on what the duties and responsibilities of each role are. The problem we have here in the United States is the push for completely independent practice by the nurse anesthetist, and that's the crux of the disagreement. I think here in the United States we have an interesting laboratory, if you will, for the introduction of non-physician practitioners. We have two groups of non-physician practitioners here. We have the nurse anesthetist, which is numerically a much larger group, and then we have certified anesthesiologist assistants, CAAs. The CAA profession has grown up from the anesthesiologist community. We were intimately involved in the creation of the field. We're still involved in their education, their certification, and their raison d'etre is to work in that team with us. There is no agenda for independent practice, and that model works beautifully. The nurse anesthetist. Now, we know that a lot of nurse anesthetists out in their day in, day out jobs work harmoniously for the good of the patients with the anesthesiologist. But there is certainly at the organizational level and in some departments, there's a fair amount of acrimony related to that oversight role that the anesthesiologists have.
And it's that word acrimony, yeah. I'm sure that some people listening, patients, for example, would think, hang on a second, you people aren't really in there fighting about who gets to look after you. And that's not how it plays out, is it?
Yeah.
No, that's why I say at the individual hospital, when people are actually taking care of patients.
The day-to-day, it's
not
work
that
together.
But it's at the organizational level. Yes. We in the ASA put a lot of time, energy, and frankly dollars into advocating our side of this issue. The American Association of Nurse used to be anesthetists. Now they've changed their name to Nurse Anesthesiology. They do the same. And so there is, at the organizational level, each side, of course, is putting out their message. And much as we see in international politics, those aren't looking for the common ground.
Just a last comment on this, because we should move on to some other items. There's been a move in the last few years in the UK in particular where perioperative medicine has really grown up a lot. For many physicians now to refer themselves as perioperative physicians, to distinguish themselves not in a judgmental way, in other words, they've got a more holistic practice from their colleagues who are specialist anesthesiologists, for example. I don't know if that language is creeping in at all.
Well, we as an organization, we feel very strongly that perioperative medicine is a very important part of the future. And of course, we just came an hour ago from our Rovenstein lecture where Dr. Sessler, who I've known for over 40 years, gave a very compelling presentation of why anesthesiology needs to embrace postoperative care more fully. I think when we look at perioperative medicine, all of us understand that we have gotten the intraoperative part to a point where it's remarkably safe. The advances of the last 30, 40 years have improved the safety of the intraoperative care dramatically. I think in the last 10, 15 years, we've made big improvements in preoperative optimization, preparing people, getting them in the best shape possible for their surgery. So we've made great progress on that. The postoperative piece is missing. That's where the mortality is. Postoperative mortality is strikingly high still for hospital inpatients. There's a lot of good to be done there. And I think that Dan's message this morning was spot on in terms of an area that needs our attention and one in which we can demonstrate the value. We have a new center that we've developed.
What I was going to say. Hasn't there been a new center developed for that?
There has been.
Yeah.
We've been working on this for years, and just organically within the organization for many years, we had a perioperative surgical home steering committee. We identified that concept of the perioperative surgical home, which was different words, but the same concept of looking at the entire perioperative period from the decision to operate until recovery. But we had that group working. Then we also had a committee on perioperative medicine, which was focused more on identifying what the curriculum might be for a fellowship in postoperative medicine. We realized we needed to kind of pull all of these people together. And so this year we created a new Center for Perioperative Medicine led by Maxime Cannison from UCLA now, but of course internationally known, extraordinarily well connected throughout the world, and a recognized expert in perioperative medicine. So I was thrilled that he agreed to take this on for us, pulling together the existing work done by TJ Gann and Rob Shekar with our other things. So we're really trying to make a real concerted push in that area.
One of the other centers, too, that you guys have developed or worked on, it was the Center for Anesthesia and Perioperative Economics, correct?
That's right. That, too, was an attempt to pull together some resources that were organizationally scattered around our organization to try and pull that together in one area, sort of elevate the profile of the work we're doing there. I think in the long run, we're probably looking at bringing some additional fairly high-level expertise in terms of healthcare economy, policy experts into that. We're not at that point quite yet, but initially we're just trying to organize to make it the most efficient for people working in that space in our organization to interact and synergize with one another.
So those are launching this year. I also know that there's some ad hoc committees that you worked on this last year. Can you tell us more about those?
There are. One of the few privileges, really, in terms of being the president, in terms of where you can just do something, is to appoint ad hoc committees. And one I appointed this year was originally called the Anesthesiologist Bill of Rights. This was an idea that came in. We thought that sounded a little too entitled. And so I think the name has now changed for, Fundamentals of a Safe and Healthy Workplace for anesthesiologists, I think. But the idea was to pull together a group of people to identify what expectations anesthesiologists can rightfully have of a workplace environment in terms of the resources that they have available to take care of the patients, in terms of their own personal safety, protection from radiation and things like that. And so there's kind of a broad range of things. And it's drawing from statements that we already had within the organization, but we identified gaps where we don't have a statement, but we felt there was something that needs to be addressed, and then that will be taken forward next year. So that was one. Another ad hoc that I was actually directed by the House of Delegates last year, specifically the Committee on Academic Anesthesiology, directed us to form an ad hoc committee on, originally they said harassment or harassment, depending on how we pronounce it. And we identified Della Lynn, who's out in Hawaii, but who's done a lot of work on patient safety and the effects of incivility in the operating room on patient safety. Very important. So she was the ideal person to put this together, and we have representation from many different committees within the organization. We've expanded it to, it's now called the Ad Hoc Committee on Harassment, Incivility, and Disrespect. And they've prepared their initial document, wanting this year to get some feedback. We'll continue. Dr. Harter's going to, I don't want to speak for him here, but I know his plan is to continue that committee and give them another year to sort of polish that up. But we think it's very important.
I saw a video earlier this week. It was a clip at the Anesthesia Patient Safety Foundation meeting that Dan Cole was chairing, which was very, very good about, look at yourself and your practices at work and the things you say and the things you do. Is that part of the endeavor?
Well, not directly, but Della Lynn, who is heading that up, she is a very outspoken, very highly respected member of the APSF board and has worked on that issue with them, which is part of the reason she came to our attention. We work on a lot of things with them to one extent or another.
Yeah.
It was really good. So keep if you see that pop up in different places, have a good look at it. It's
Keep
really
an eye out
good.
for that. Yeah.
No, I think Della and this committee, they will be the world's experts on this on this topic.
Interesting. Yeah. But I wanted to bring Dr. Harter in and tell us a little bit about some of the things that you're looking forward to as you are incoming and expanding the work that Dr. Champeau and others have done over the last year.
Well, thank you. Yes, as you can glean from the list that Dr. Champeau has gone through, there is a very full plate already.
Yes.
Starting into the year. So certainly
You're going to be busy.
I will be busy keeping those initiatives going forward. Certainly the centers, both perioperative medicine and on economics, those are both critically important and really important to the future, both current and future state for our specialty. And those are really, they're out of the starting gate, but they're not very far out of the starting gate, I would say. So I think helping to assure that those are moving forward in a positive direction, that they have the resource and support that they need in order to succeed. I have full confidence in the people that are leading both of those centers and are in the leadership team of those centers, that we have absolutely the right people there. But there's a lot of work to be done there. And many of the ad hocs, including the ones that we've discussed, I plan to continue those. In addition to all of those things, and recognizing that the crystal ball is never perfectly clear, and that there may be issues that were not even on our radar currently that we'll have to address throughout the year. Certainly the national standards of practice within the VA, that is on a course where there will be some recommendations that will come forward undoubtedly at some point in this governance year. And we are very active with engagement, as Dr. Champeau had mentioned, with some leading veteran service organizations in addressing those issues, but there will be a good bit of further activity on that in the year to come. I had the privilege just within the last few weeks to testify before the Health Subcommittee of the Committee on Veterans Affairs in the House of Representatives.
The real House of Representatives, yes.
Delegates this time. And just to provide testimony supporting maintaining the current physician-led anesthesia care model for our veterans. I think this is the type of thing that the more light we can shine on it, the more that veterans and citizens will be supportive of this, because on its face, to suggest that our veterans who have no challenge with access to care, to anesthesia care within the VA system, that somehow there's a solution to a problem that doesn't exist, that requires that nurse anesthetists provide care independently for some of our, certainly they're all heroes, but certainly among the more complex patients that require anesthesia care. It's not just a double ANA versus ASA issue. It is a much broader issue that I really think the more that our public knows about that, the more they will side with our veterans in assuring that they continue to receive the highest quality of care.
Now, one of the questions I wanted to ask you too, you've been really involved in developing the workforce strategy, correct, for the ASA. Can you tell us a little bit more about that?
Certainly. And certainly Dr. Champeau as well really gets credit for helping to form the initial workforce summit that met about 15 months ago, I guess, June of 22. And at that first workforce summit, we convened a broad array of stakeholders. So anesthesiologists from academic practice, private practices, small, medium, large groups, healthcare executives, representatives of the American Board of Anesthesiology, of the ACGME Residency Review Committee for Anesthesiology. It really did a very thoughtful review of what are the current challenges with our workforce supply and demand, then what are some potential work streams to come from that we can develop potential resources and solutions for various aspects of that. So out of that initial workforce summit, we developed really 4 working groups, 2 on the supply of anesthesia professionals, 2 on the demand for anesthesia professionals. And all of those groups have been very engaged over this past year. Anyone who would like to see a snapshot of those initial efforts in the November 22 ASA Monitor, Mary Dale Peterson who leads pretty much anything that's important. within ASA. She
still very active after her presentation.
She leads our workforce efforts as well, and so she and some of the various work group leaders provided great detail in that monitor edition about those issues. So to sort of reassess where we are in those efforts and to identify what are the further next steps that we need to do, we have another workforce summit convened for late November, early December. And so many of the same stakeholders, but some even further, I would say, expansion of some of the important stakeholders. We'll have representatives from the American College of Surgeons, American Hospital Association, for example, that I think will further give us, as much as possible, a really global view of the workforce issues that we're facing. And there's the bad news is there's not a quick, easy fix will suddenly be right-sized with our staffing. But that being said, there's a number of initiatives that I think ASA can help to facilitate, and certainly just providing resources and education for our members for addressing various facets of that.
For those young clinicians in the broader sense who are listening, who are considering a career in the perioperative space, it's still one of the, if not the most exciting parts of medicine, I would say.
Absolutely. And at least in the United States, our medical students are voting with their feet. They very much view anesthesiology as a very attractive and desirable specialty. I have been mostly in academic anesthesiology for the 30 years of my career in various roles, including program director for residency and then department chairman. So I've been very involved with recruitment of medical students into the specialty for a very long time. And I have never in my life seen the way that it has become so competitive as it has over the last couple of years. So that's, of the storm clouds overhead facing our workforce issues, the very bright silver lining is absolutely that there are so many just terrific medical students seeking a career in anesthesiology.
Well, I had a conversation a couple nights ago with a medical student who was here at our meeting, and he comes from Indiana University. And
Go Hoosiers.
I grew up in Indiana. I didn't go to school there, but for years it's been the largest medical school in the country because it's the only medical school in the state. And so, it has a need to create a lot of physicians for the population. But he told me that a third of the graduating class wanted to go into anesthesiology. Now, the school was looking to try and redirect some of their interests elsewhere because a third, I was shocked when I heard that.
Yeah.
And relative to historically in the realm of 5, 6, 7% of American medical student graduates would pursue careers in anesthesiology. So it is a lot of excitement around it.
And with the perioperative space, I know I keep banging on about it. From that moment of contemplation to full recovery, you can bring your physicianly skills to bear across the whole spectrum. So.
Yeah, and again, I don't want to bang on the same drum, but Dan Sessler this morning, his message was that the field of anesthesiology needed to create a fourth major subspecialty, post-operative care along paid intensive care, traditional operating room. You obviously were prescient as well in identifying this as a real opportunity for the specialty.
Yeah, for sure. Gentlemen, great conversation. Thank you so much. I think we've heard a lot of what's happened in 2023 and what to expect in 24. I know we could continue to go on because there's still a lot of initiatives we didn't even get to cover. Dr. Champeau, as you are leaving your presidency, what are some of the things that you're really most proud of and actually some of your fondest memories over this last year?
In terms of what I'm most proud of, I do think that we made progress on our usual advocacy agenda. Obviously we did very well at the state level this year, but we held our own on that. But I wouldn't say that's where my biggest accomplishments would have lied. I think that, again, laying the foundation for the future, the new editor, new CEO, the work we've done establishing the centers that we referred to earlier, continuing work on our committee on market-based strategy, which Dr. Harter has chaired. So I think we've done a lot of things where we've sort of poured the metaphorical concrete, laying the foundation for the future. So that's I think, probably where I feel like I've accomplished something. We also put a lot of effort into trying to change the culture of our board meetings. We have an extraordinarily large board of directors, no organization would design itself with 65-member board, but trying to make their meetings more interactive, more deliberatively. We had fallen into a habit of talking at them with PowerPoint presentations. So we really made a lot of progress on trying to get them more engaged, more conversation, more deliberative. So that's all good. My fondest memories, being out on the road, talking to our members at our meetings around the country is absolutely number one. The thing that I got to do this year that I haven't done in the past is also represent the society internationally. And probably one of the best experiences for me was a meeting I just came back from, the Chinese Society of Anesthesiology in Changsha, China. As it turns out, my wife is of Chinese ancestry. My son speaks passable Mandarin. So they came along with me. My son did some translating for us. But I was really treated as an honored guest of the Chinese Society while I was there. I gave several lectures, visited hospitals. It was really an absolutely wonderful experience.
Yeah, that's great. And Dr. Harter, what are you most excited about for this year?
First, I want to just acknowledge what a terrific president Dr. Champeau has been this past year. We are greatly in his debt, and his impact on ASA will be felt for years to come. So can't say enough positive about the job
Very kind of you.
that Michael has done. But in the year ahead, it's just a tremendous honor to be able to lead such an amazing organization as the American Society of Anesthesiology. So in spite of all the challenges, there's tremendous opportunity. And we have, in my remarks to the House of Delegates a couple of days ago, I just remarked on the tremendous wealth of talent and commitment of so many individuals, both our physician members as well as our staff, and to have the opportunity to help to guide and lead that group is just phenomenal. As far as any specific agenda that I've got in the year ahead, in addition to the 100 or so balls that I'll be trying to juggle and keep in the air, I've always had, not always, but for the last several years, had a particular interest in wellness for our members. We have a very robust committee on physician well-being that does a terrific job. They've provided a lot of great resource for our members and do a lot of great work. And I've been in some conversations over the last several months that I think we have an opportunity in the year ahead to provide really some additional, very robust resources for our members and even for our members' family members with respect to various wellness resources. So I'm hopeful that will come to fruition because it's a growing challenge and it's certainly fueled by the workforce challenges, but there's a lot of pressures coming to bear on our members. To the extent that ASA can provide some resource to help our members to navigate that, I think would be a tremendous benefit to our members.
Dr. Champeau, I just want to add congratulations for your term. Thank you very much for being a wonderful partner, not only to the other anesthesia colleges, organizations, Peroperative medicine around the world, but also to TopMedTalks, the very generous partnership here that allows us to sustain free open access medical education. So thank you for all of that. And Dr. Harter, good luck.
Thank you. I need it.
So say your words of advice for Dr. Harter. I know you're closing.
Well, he's a very experienced leader. He chaired a university department for over a decade, which is one of the most difficult jobs imaginable in anesthesia. So he, I think, comes into this extraordinarily well prepared, far better than someone like myself who's practiced in a smaller environment or just been a member of a university department. I guess I would just to say to try to enjoy some of the unique opportunities that are afforded, representing the society as a guest of some of the international societies when I've gone abroad. That's been great fun. And I made this point, and you made it as well. Both of us owe a huge debt to our spouses for the additional burdens that they've shouldered over these decades that we've been off doing things. And one of the real benefits of the presidency is that your spouse gets to accompany you on most of these opportunities. And of course, one morning when I was running off to give a lecture, and my wife was packing because we had to dash off it. And she said to me, she goes, you really couldn't do this without me. I said, no, I believe me, I realize
100%.
But enjoy that time with the spouse. It's a very special experience.
Yeah. Well, Dr. Michael Champeau, Dr. Ronald Harter, thank you so much. Congratulations on the last year and the year incoming. You're going to do fabulous. It's going to be wonderful. Thank you all so much.
Thank you.
Thank you for joining us here on TopMedTalk. You can find more conversations from last year and previous meetings at TopMedTalk.com, and all of our wonderful content that we've recorded here, where we talked a lot about some of the subject matter that we discussed today. So please do check that out. We're on X, formerly known as Twitter, LinkedIn, Facebook. We're there. Your favorite podcatcher, we're there as well. If you see any of our YouTube videos, give those a big thumbs up. That helps us as well. Thanks so much again to the ASA. We could not do this without you guys. Thank you so much.
Thank you.
Cheers, everyone.
It's been a pleasure.
TopMedTalk.
Thanks for downloading TopMedTalk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, TopMedTalk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.